urologists are finally bringing to light an unsettling truth. If you are past the age of 60, stop whatever you are doing and listen with extreme attention. My name is Dr. Andrew Namdi, a urologist with more than 25 years of clinical practice, and what I am about to reveal to you may genuinely protect your intimate life and your dignity as a man. Every day in my clinic, I see men in their 60s, 70s, even 80s. Some are broken, some are embarrassed, others have completely surrendered. All of them are facing the same silent and worsening condition. They dismissed the early signals. They assumed it was simply normal with age. Now many of them wake up 5, 6, sometimes even 10 times each night. Some rely on protective pads. Others have completely withdrawn from social life, terrified of a public accident. But here is the reality no one dares to say openly. In 87% of situations, this suffering could have been entirely prevented. Yes, you heard that accurately. Most prostate issues are not an unavoidable result of aging, but the direct consequence of daily behaviors and mistakes you are likely making right now, without even being aware of them. I am breaking the medical silence. I am going to reveal the 10 most damaging mistakes that slowly transform your prostate into a ticking biological bomb. And listen carefully. Because the final mistake, the one revealed at the end, is so deeply rooted in daily routines that 9 out of 10 men commit it every single morning. This single habit alone can double your risk of serious prostate conditions. If you have ever asked yourself why your urine flows like a leaking tap, or why you constantly feel that your bladder never fully empties, write bladder in the comments right now. I want to understand your situation so I can help you more effectively. Mistake number 10. Voluntary dehydration. Many men intentionally cut back on their water consumption in an attempt to reduce frequent trips to the bathroom. On the surface, this choice appears sensible. It feels practical. Yet from a medical perspective, it is one of the most damaging decisions they can make for prostate health. When the body is deprived of adequate hydration, urine becomes thick, concentrated, and chemically aggressive. Instead of safely carrying waste out of the system, it traps toxins and irritants in a smaller volume. This dense urine repeatedly irritates the bladder lining and places constant inflammatory stress on the prostate, day after day. I once treated a patient named Robert, a former engineer who believed he was controlling his urinary issues by limiting fluids. Throughout the day, he barely drank water. What he did not realize was that his strategy was silently worsening his condition. His prostate was swollen, inflamed, and sensitive. Each night, he woke multiple times, exhausted, discouraged, and confused about why his symptoms kept progressing. Once we slowly reintroduced proper hydration, something remarkable happened. His urine became clearer. The burning sensation eased. Inflammation gradually subsided. Most importantly, the urgent and constant need to urinate began to fade. What he feared most, drinking water, turned out to be part of the solution. The prostate is not threatened by water. It is threatened by concentrated toxins and chronic irritation. Men who restrict fluids often fall into a destructive loop. Drinking less creates irritation. Irritation increases urgency. Urgency fuels fear. Fear leads to even less water intake. Over time, this cycle intensifies symptoms instead of relieving them. The answer is not avoidance, but intelligent hydration. Small, steady sips throughout the day. Paying attention to urine color. Supporting the body instead of working against it. Mistake number 9. Extended sitting. Remaining seated for long periods places constant pressure on the pelvic region. Blood circulation slows. Oxygen delivery to vital tissues drops. Waste products linger instead of being cleared. Over time, this silent stagnation creates the perfect environment for inflammation and dysfunction to develop. I worked with Mark, a former office professional who spent most of his days sitting at a desk. Despite following his prescribed treatments carefully, his symptoms continued to worsen. Frequent urgency, weak flow, and discomfort became part of his daily life. Medication alone was not enough. The missing element was movement, When we introduced simple but consistent movement into his routine, the change was noticeable. Standing up every hour. Walking for a few minutes. Gentle stretching to activate the pelvic area. These small adjustments restored circulation, improved nerve communication, and gradually reduced pressure on the prostate. His bladder control improved, and nighttime disruptions became less frequent. The prostate relies heavily on healthy blood flow. Without circulation, it cannot function properly. Without oxygen, tissues struggle to repair themselves. Extended immobility compresses blood vessels, weakens pelvic muscles, and interferes with nerve signals that regulate urination. Over time, inflammation increases, and symptoms that are often blamed on aging begin to appear. But this is not a natural consequence of growing older. This is mechanical stress created by daily habits. Modern lifestyles encourage stillness. Long hours in chairs, cars, and couches quietly damage the pelvic region. The body was not designed for this level of immobility. Movement is not a luxury. It is not optional. It is therapeutic. Simple actions make a measurable difference. Frequent posture changes. Short walks. Gentle activation of the lower body. These movements restore blood flow, reduce pressure, and support prostate health naturally. Mistake number 8. Excessive caffeine intake. Caffeine is a powerful stimulant. While it energizes the mind, it places significant stress on the urinary system. It overstimulates the bladder muscles and tightens the bladder outlet, creating a harmful imbalance. Urine production increases, yet complete emptying becomes more difficult. This combination leads to urgency, discomfort, and frequent interruptions both day and night. I treated a patient named Pierre, a retired teacher who relied heavily on coffee throughout the day. Several cups in the morning, more in the afternoon. He believed caffeine helped him stay focused and alert. What he did not realize was how strongly it was aggravating his urinary symptoms. His bladder became overreactive. His nights were broken by repeated trips to the bathroom, leaving him exhausted and frustrated. When we gradually reduced his caffeine intake, the effects were striking. His bladder calmed. Nighttime awakenings decreased. Urgency softened. Sleep became deeper and more restorative. For the first time in years, he felt a sense of control returning. Caffeine excites the nervous system. The prostate thrives in calm, stable conditions. Stimulants increase muscle tension and nerve sensitivity within the pelvic region. This leads to spasms, irritation, and inflammation. Over time, the bladder becomes hypersensitive, reacting even to small amounts of urine. Many men experience this without ever connecting it to their daily caffeine habits. Replacing coffee with gentler alternatives made a measurable difference. Herbal teas, caffeine-free infusions, and warm water supported relaxation instead of overstimulation. As spasms decreased, urgency followed. Pierre's case is far from rare. Many men unknowingly worsen their symptoms through excessive caffeine consumption. What sharpens mental alertness often overwhelms the bladder. The goal is not deprivation, but balance. Mistake number 7. Ultra-processed foods. Highly processed foods do far more than simply provide calories. They disrupt hormonal balance, intensify systemic inflammation, and contribute directly to prostate enlargement. Over time, these products create an internal environment that encourages swelling, irritation, and accelerated tissue growth within the prostate. I cared for a patient named Luke, a widower who had gradually come to rely on ready-made meals. Frozen dishes, packaged foods, and processed snacks became his daily routine. They were convenient, comforting, and easy. Unfortunately, they were also quietly fueling his prostate problems. His prostate volume increased rapidly, and his symptoms worsened despite standard medical monitoring. When we corrected his diet, the change was measurable. Inflammatory markers decreased. His prostate irritation eased. Even his PSA levels improved, reflecting a calmer and more stable internal state. What medication could not fully achieve, nutritional correction helped unlock. Food is never neutral. Every bite sends chemical signals throughout the body. Ultra-processed products contain additives, preservatives, excess sodium, refined sugars, and industrial fats. These substances strain hormonal pathways and trigger chronic inflammation. For the prostate, this constant chemical assault leads to swelling, pressure, and progressive dysfunction. Many men experience worsening symptoms without ever suspecting that their daily meals are part of the problem. In contrast, whole foods support repair and balance. Fresh vegetables, natural proteins, healthy fats, and unrefined carbohydrates nourish the body without provoking inflammatory responses. These foods stabilize blood sugar, reduce oxidative stress, and support healthy hormone signaling, conditions the prostate depends on. Luke's experience is common. Men often underestimate the power of their diet because the damage is gradual, silent, and cumulative. Mistake number 6. Chronic urinary retention. Regularly delaying urination places extreme stress on the urinary system. When the bladder is forced to hold excessive volumes for long periods, it becomes overstretched and strained. This pressure is transmitted directly to the prostate, compressing surrounding tissues and disrupting normal function. I once treated a patient named Omri, a passionate card player who often ignored the urge to urinate during long social games. One evening, his bladder reached its limit. The result was an emergency hospitalization and catheterization. What appeared to be a single incident revealed a deeper issue. Years of repeated urinary retention had weakened his bladder muscles and compromised prostate stability. The bladder was never designed to endure endurance challenges. It is meant to empty regularly and efficiently. When urine is held back, bladder walls lose elasticity. Nerve signals become less responsive. Over time, incomplete emptying becomes common, creating residual urine that fosters irritation and inflammation. The prostate, positioned directly beneath the bladder, absorbs much of this mechanical stress, increasing discomfort and urinary symptoms. Many men believe that delaying urination is harmless or even practical. Meetings, long drives, social gatherings, convenience often overrides biological signals. But ignoring these signals comes at a cost. Chronic retention gradually undermines both structure and function within the urinary system. Once Omri learned to respond promptly to bladder urges, recovery began. Regular emptying reduced pressure. Muscle tone slowly improved. Nighttime urgency became less frequent. His system regained balance through respect, not resistance. Responding to the urge to urinate is not a weakness. It is a form of protection. Mistake number 5. Tobacco. Smoking is far from a harmless habit, especially when it comes to prostate health. Every cigarette delivers a stream of toxic chemicals into the body, many of which eventually reach prostate tissue. These substances do not remain superficial. They penetrate deeply, disrupting normal cellular function and gradually weakening the biological balance of the prostate. Stephen S. story illustrates this reality with painful clarity. A lifelong smoker, he never truly grasped the consequences of tobacco on his intimate health. When he was diagnosed with an aggressive form of prostate disease, the realization was devastating. His regret was neither subtle nor abstract. It was heavy, emotional, and rooted in the understanding that years of smoking had silently worked against him. In hindsight, Stephen came to see tobacco as a constant, underestimated enemy. Tobacco harms the prostate through several destructive mechanisms. It restricts blood flow by narrowing blood vessels, depriving prostate tissue of oxygen and essential nutrients. It damages cellular DNA, increasing the likelihood of dangerous mutations. Smoking also accelerates degenerative processes, promotes chronic inflammation, and weakens the body's natural repair systems, creating conditions in which disease can thrive. Quitting smoking, therefore, is not merely a symbolic decision or a matter of willpower. It is a biological intervention. When smoking stops, the body begins to heal almost immediately. Blood circulation improves, oxygen delivery increases, inflammation gradually decreases, and cells are given a healthier environment in which to function and recover. Giving up tobacco means offering the prostate, and the entire body, a genuine opportunity for repair and protection. It marks a shift away from slow, cumulative damage toward active regeneration and long-term health preservation. Mistake number 4. Avoiding screening. Avoiding medical screening does not shield anyone from disease. It does not make a potential problem disappear or reduce its severity. What it truly prevents is early detection, the one factor that often determines whether a condition can be treated effectively or becomes far more difficult to manage. Ignoring examinations may feel reassuring in the short term, but it carries serious long-term consequences. Adebayo experience is a clear and sobering example. For years, he postponed seeing a doctor, convincing himself that the absence of severe symptoms meant everything was fine. Routine checkups felt unnecessary, even uncomfortable, and he believed that delaying them was harmless. By the time Michel finally sought medical advice, the situation had changed dramatically. The disease had progressed, and the range of available treatment options had narrowed. What could have been addressed early had become complex and restrictive. Screening plays a critical role in prostate health because many serious conditions develop silently. In their early stages, they often produce no pain or obvious warning signs. Regular examinations allow physicians to detect abnormalities before they escalate, offering a window of opportunity for simpler, less invasive, and more effective treatment. Early detection is not about fear, it is about foresight. There is also a powerful psychological barrier surrounding screening. Many men associate exams with embarrassment or vulnerability. This perception is deeply misguided. Medical screening is not a source of humiliation, it is an act of responsibility. It reflects respect for one's own body, one's future, and the people who depend on one's well-being. Choosing to be screened is choosing control over uncertainty. It transforms a passive approach into an active one, replacing denial with awareness. Mistake number 3. Excess red meat. Consuming large amounts of red meat is often perceived as normal, even beneficial, yet excessive intake can quietly undermine prostate health. Red meat, especially when eaten daily or prepared at high temperatures, promotes inflammation within the body and increases exposure to carcinogenic compounds. Over time, this inflammatory environment creates conditions that allow chronic disease to develop and progress. Chukwudi's story offers a powerful illustration. A Nigerian man who grew up associating meat-heavy meals with strength and prosperity, he consumed red meat almost every day for years. Beef, goat meat, and processed meats were staples of his diet. When routine medical tests began to show unfavorable health markers, his physician advised a significant dietary change. Skeptical at first, Chukwudi eventually reduced his red meat consumption and replaced it with more fish, vegetables, legumes, and plant-based proteins. The results were striking. Within months, several of his inflammatory markers improved dramatically. His energy levels increased, digestion became easier, and follow-up tests reflected a healthier internal balance. This shift made it clear that food choices directly influence biological processes, often more quickly than expected. Excess red meat contributes to inflammation in multiple ways. It contains saturated fats that stimulate inflammatory pathways and, when cooked at high temperatures, produces harmful substances that can damage cells and DNA. Processed red meats further increase this risk through added preservatives and chemicals. While occasional consumption may not be harmful, constant excess overwhelms the body's ability to regulate inflammation. Moderation is the key protective factor. Reducing intake does not mean eliminating pleasure or cultural traditions. It means restoring balance. Mistake number 2. Abdominal fat. Abdominal fat is not merely excess weight stored around the midsection. Fat accumulated in this area actively disrupts hormonal balance and places persistent stress on the prostate. Known as visceral fat, it behaves like a metabolically active tissue, releasing hormones and inflammatory substances that interfere with the body's normal regulatory systems. Oluwaseun's story clearly illustrates this process. Over the years, he paid little attention to his increasing waist size, assuming it was a normal part of getting older. At the same time, he began experiencing frequent nighttime urination, which disturbed his sleep and affected his daily energy. When he finally sought medical guidance, he learned that his abdominal fat was likely contributing directly to his prostate-related symptoms. Following medical advice, Alyawazian focused on reducing his waist circumference through balanced nutrition, regular physical activity, and gradual weight loss. As the centimeters around his waist decreased, the improvements were striking. His nocturnal urinary symptoms declined sharply, his sleep quality improved, and he felt more alert during the day. Medical follow-ups suggested reduced prostate pressure and improved hormonal regulation. Abdominal fat actively alters key hormones, including testosterone and estrogen, creating conditions that can promote prostate enlargement. It also produces inflammatory compounds that sustain chronic inflammation, further aggravating prostate tissue. Additionally, visceral fat increases insulin resistance, which amplifies hormonal imbalance and systemic stress. Fat is not passive or neutral. It continuously sends biochemical signals that influence organ function. Reducing abdominal fat is not a cosmetic goal, it is a strategic health decision. By controlling waist circumference, inflammation decreases, hormonal balance improves, and prostate stress is reduced, supporting long-term health and overall quality of life. Mistake number 1: chronic stress. Chronic stress is often dismissed as a purely psychological issue, yet its impact on the body is deeply physical. Persistent tension tightens the pelvic muscles, disrupts normal circulation, and places continuous strain on the prostate. At the hormonal level, long-term stress elevates cortisol, the body's primary stress hormone, while simultaneously suppressing testosterone. This imbalance weakens recovery mechanisms and accelerates functional decline. Kunnel's experience reflects this reality. As a senior professional working in a high-pressure environment, his days were filled with constant deadlines, decision-making, and mental overload. Over time, he began to experience pelvic discomfort, sleep disturbances, and reduced vitality. Like many men, he initially viewed stress as something to push through, believing it was a sign of resilience rather than a threat to health. When symptoms became impossible to ignore, Kunnel explored structured breathing techniques and relaxation protocols under professional guidance. These methods were not abstract or spiritual exercises. They were practical tools designed to calm the nervous system. By practicing controlled breathing, progressive muscle relaxation, and daily moments of mental decompression, his body gradually shifted out of a constant fight-or-flight state. The results were significant. As stress levels decreased, pelvic tension eased, sleep improved, and hormonal balance began to normalize. His sense of control returned, not through force but through calm. This transformation highlighted a crucial truth: stress is not a mental weakness. It is a form of physiological aggression that continuously assaults the body when left unmanaged. Calm is not passive. It is an active healing state. By reducing chronic stress, the body lowers cortisol, supports testosterone production, relaxes muscular tension, and restores internal balance. Prostate recovery strategy. Correcting these 10 mistakes creates measurable improvement in urinary comfort, sleep quality, and prostate health. Men who apply these principles consistently experience dramatic symptom reduction and regain control over their bodies. These outcomes are not accidental. They are the result of informed choices. Gentlemen, your prostate health is not predetermined. It is shaped by daily decisions. I have witnessed men restore vitality, confidence, and dignity by addressing these factors. I have also seen the consequences of ignoring them. You now possess the knowledge and the strategy. The only remaining question is whether you will act. Share this message with every man who needs it. Correct the first mistake immediately. Your prostate is listening.